In a world of constant stimulation, from endless scrolling to instant notifications, many are turning to dopamine fasting 2.0 as a way to hit the mental reset button. Promoted as a path to greater focus, emotional balance, and even productivity, it's gained a cult-like following in Silicon Valley and beyond. But is this trend a legitimate psychological tool, or just another overhyped wellness fad? In this episode, we dive into the science, the skepticism, and the surprising truth behind dopamine fasting. Dopamine fasting 2.0. Mental reset or just hype? So before we start, make sure to hit the like button and subscribe to my channel. 1. Origins of dopamine fasting. Where did it all begin? Dopamine fasting, though it sounds New Age or Silicon Valley born, actually finds roots in age-old practices like meditation, asceticism, and digital detoxing. The term dopamine fasting 2.0 was popularized by Dr. Cameron Sepa, a clinical psychologist and professor at UCSF, who aimed to help tech professionals regain control over impulsive behaviors. The concept gained viral traction in late 2019, particularly in startup and wellness communities. Contrary to its name, dopamine fasting doesn't literally reduce dopamine levels. Instead, it focuses on limiting overstimulation from high-reward behaviors like binge-watching, scrolling social media, or compulsive snacking. The goal is to allow the brain to reset its reward system and regain sensitivity to smaller, more meaningful pleasures. While critics argue the name is misleading, proponents suggest the idea is valuable in an age of constant digital noise and hyperstimulation. But is this really a scientific reset, or another overhyped trend? 2. Understanding dopamine. The brain's reward chemical. To understand dopamine fasting, we first need to understand dopamine itself. Dopamine is a neurotransmitter that plays a crucial role in the brain's reward and motivation systems. It's not the chemical of pleasure, as commonly believed, but rather one of anticipation and motivation. It spikes when we pursue rewards, like eating delicious food, getting likes on a photo, or receiving a compliment. Over time, repeated exposure to high dopamine activities can desensitize our receptors, making us crave more intense stimuli for the same satisfaction. This leads to habits that are hard to break: doom scrolling, binge eating, gambling, and even workaholism. Dopamine fasting aims to combat this cycle by temporarily cutting off these high-reward stimuli. The theory is that by doing so, our brains will recalibrate and will regain motivation for more sustainable long-term goals. But is this neurobiologically sound or just a fancy label for self-discipline? 3. What is dopamine fasting 2.0 really about? Dopamine fasting 2.0, as designed by Dr. Sepa, isn't about cutting off all sources of joy or becoming a monk overnight. It's a behavioral intervention meant to help people gain control over compulsive behaviors. The core principle is to temporarily abstain from problematic behaviors like emotional eating, compulsive phone use, porn consumption, gambling, or any activity that feels habit-forming and distracts from real goals. Unlike older detox trends, dopamine fasting 2.0 is more customized and focused. The idea is not to stop producing dopamine, because that's impossible, but rather to pause impulsive behaviors that lead to dopamine overdrive. Participants typically fast for a set time each day or week. During this time, they avoid triggers, engage in low-stimulus activities like journaling, walking, or meditation, and reflect on their behavior. It's less about punishment and more about mindful behavior modification, like hitting the reset button on your brain. 4. Science versus sensationalism. What research says. One of the biggest criticisms of dopamine fasting is the scientific misunderstanding behind the name. Experts argue that dopamine levels can't be fasted like glucose or calories. The brain continuously produces dopamine as it's essential for movement, cognition, and survival. However, the core psychological mechanisms behind dopamine fasting do hold some merit. Behavioral addiction research shows that stimulus control, mindfulness, and environmental restructuring can reduce compulsive behaviors. This supports the psychological underpinnings of dopamine fasting, even if the neurochemical explanation is shaky. Cognitive behavioral therapy, CBT for example, uses similar techniques to help patients develop healthier routines. That said, no clinical trials have specifically validated dopamine fasting as a standalone treatment. It's still considered anecdotal and experimental. Yet anecdotal evidence from tech entrepreneurs, productivity influencers, and mental health advocates continues to flood the internet. It might not be a cure, but it could be a tool, if done right. 5. How to practice dopamine fasting the right way. If you're curious about trying dopamine fasting, it's essential to do it strategically, not obsessively. First, identify which behaviors you want to reset. Is it scrolling TikTok? Overeating snacks? Constant multitasking? Choose 1 or 2 behaviors and set a clear time for your fast, maybe 1 hour per day or an entire Sunday. During the fast, remove temptations and replace them with low-stimulation activities like walking in nature, journaling, stretching, or just sitting in silence. Avoid extremes like cutting off all interaction or staying in a dark room. This isn't sensory deprivation therapy. The key is mindfulness and reflection. You want to observe how your urges arise and pass without acting on them. After the fast, reintroduce behaviors consciously. Ask yourself if they truly serve your long-term goals. Dopamine fasting isn't about asceticism, it's about awareness. When practiced in moderation, it can become a powerful method for regaining self-discipline and mental clarity. 6. Benefits reported by practitioners. Many who practice dopamine fasting report improvements in self-awareness, focus, and emotional regulation. After regular fasts, some notice they're less reactive to minor stresses and more patient in social interactions. Others experience a renewed appreciation for simple pleasures, like a quiet walk, a home-cooked meal, or deep conversation. Productivity is another common benefit. By cutting out digital distractions even for a few hours a day, many find they can focus more deeply on meaningful tasks. Some even claim enhanced creativity and decision-making due to the mental space gained from reduced sensory clutter. On the emotional level, dopamine fasting can help people become more intentional with their choices rather than acting out of habit or impulse. While these are subjective reports, they align with broader research in digital wellness and mindfulness. The results aren't magical, but they're measurable for those who stay consistent. 7. The criticism and misuse of dopamine fasting. Despite its popularity, dopamine fasting has faced harsh criticism from neuroscientists and mental health experts. The name itself is misleading. It makes people believe they're somehow flushing out dopamine, which is biologically inaccurate. Some influencers have taken the trend to extremes, promoting complete silence, eye contact avoidance, and even monk mode isolation, which veers dangerously into pseudoscience. Overdoing dopamine fasting can lead to social withdrawal, increased anxiety, and even burnout, especially if it becomes a perfectionist ritual rather than a helpful tool. Critics also point out that this trend may pathologize normal pleasure-seeking behavior, creating guilt around enjoying entertainment, food, or social media. It's crucial to approach dopamine fasting with a balanced mindset, using it as a tool for regulation, not repression. Like any habit change, it should be rooted in personal growth, not punishment. Misuse of the concept risks turning a potentially empowering idea into yet another toxic self-help fad. If you like this video and would like to see more like it, please give it the thumbs up, leave a comment, and click the button to subscribe.